It started as just another shift, but by the end of it, one nurse's entire career was over, a mother-to-be was in distress, and the Nursing and Midwifery Council had launched a formal misconduct investigation, all because of one medication, one oversight, one lie. Let's call her Nurse A senior staff nurse with over 22 years of experience, known by her team for being calm, efficient, and resourceful, the kind of nurse you'd want at your bedside. It was a Wednesday morning on the gynecology ward of a large NHS hospital in the south of England. The ward was short-staffed as usual, and tension was already running high. At around 9:45, a new admission came through. A 32-year-old woman, 11 weeks pregnant, suffering from hyperemesis gravidarum, a severe, relentless form of morning sickness. She was dehydrated, weak, and visibly distressed. The smell of antiseptic, the bright lights, the quiet hum of machines, it all felt overwhelming. A junior doctor prescribed Buscopan to ease the woman's stomach cramps. But there was a problem. The patient's file, both electronic and handwritten, clearly stated that she had a documented allergy to hyoscine, the active ingredient in Buscopan. Red text, underlined, allergy, Buscopan, rash and vomiting in 2017. But the file was long, and Nurse A, under pressure, glanced only at the medication chart. She collected the dose, walked briskly into the bay, and said, "Let's get something into you. This will help with the cramps." The patient hesitated. "Are you sure I can take this? I think I've had a reaction to something like it before." But Nurse A, perhaps trying to reassure her, or silence a growing doubt in her own mind, responded, "It's safe. I wouldn't give it to you otherwise." And then she administered the medication. Within minutes, the patient began to itch. Her arms reddened. Hives formed across her chest. She became nauseous, dizzy, and began vomiting violently. Another nurse ran for help. An on-call doctor arrived and immediately suspected a drug reaction. The patient was stabilized, her vitals monitored closely. Fortunately, there was no lasting harm to her or the baby, but the damage was already done. And what Nurse A did next would seal her fate. She didn't tell the medical team that she had administered Buscopan. She didn't document the error in the notes. When the patient asked weakly, "Was it the injection?" Nurse A reportedly said, "It couldn't have been that. It's probably just your pregnancy." Over the next 48 hours, as hospital management began to investigate the incident, Nurse A maintained her version of events. "I wasn't aware of any allergy. It wasn't clear in the notes. I thought it was safe." But the evidence told a different story. The allergy had been flagged in 3 separate systems. The patient had voiced concern prior to the injection. And crucially, there was no record of the medication being given, because Nurse A had never written it up. When questioned formally, she became defensive, then evasive, then silent. The hospital filed a referral to the Nursing and Midwifery Council. Months later, at the tribunal, the facts were laid bare. The NMC panel acknowledged Nurse A's long service. They noted her previous clean record, the pressures of the shift, and the emotional toll of the job. But they also highlighted something much more serious: the dishonesty. The panel said, while the clinical error was serious, it was Nurse A's lack of candor, failure to report, and attempt to mislead her colleagues that constituted misconduct of the highest order. They ruled that her actions were dishonest, reckless, and incompatible with continued registration as a nurse, Nurse A, was struck off the register. Her career, 2 decades of it, was over. The NMC panel acknowledged Nurse A's long service. They noted her previous clean record, the pressures of the shift, and the emotional toll of the job. But they also highlighted something much more serious: the dishonesty. The panel said, while the clinical error was serious, it was Nurse A's lack of candor, failure to report, an attempt to mislead her colleagues that constituted misconduct of the highest order. They ruled that her actions were dishonest, reckless, and incompatible with continued registration as a nurse. Nurse A was struck off the register. Her career, 2 decades of it, was over. Now here's the hard question. Should one catastrophic mistake define a nurse's entire career? What if she had told the truth straight away? Could suspension and retraining have been a fairer outcome? Or is the loss of public trust too great to ignore? Leave your thoughts in the comments. Should the NMC show more mercy, or does patient safety demand absolute accountability? We want to hear from you, especially if you're a nurse or healthcare professional. Don't forget to like, subscribe, and share this video, because these are the stories that matter, the ones that could